I get this question all the time. What's the difference between Medicaid and Medicare? Don't I already have Medicaid? Don't I already have Medicare? Well, they're two different things. So Medicaid is a state and federal program that provides health insurance for free for people who are low income. That's going to include children, pregnant women, elderly individuals, and people with disabilities. Eligibility is based primarily on income level, but other factors like age, disability status, and family size can play a role. Each state has its own limits on their income, so you might want to double check with your state, although federal guidelines must be followed. So people with low income, regardless of age, can qualify for Medicaid. Coverage. So Medicaid does cover full major medical. That's going to include your day-to-day doctor visits, your hospitalization, God forbid, even dental and vision and hearing and everything in between. Hospital stays, prescription drugs, that is all going to be included in your Medicaid policy. Medicaid is generally low cost or free for the beneficiary if they qualify based again on their income and their household size, location, and also zip code. Medicaid is generally free or low-cost insurance, but some states will have a premium associated with it. So you might want to double check with your state and also double check with the county of that state, but it is rare. Medicare. So let's get into Medicare. So Medicare is a federal-based health insurance program for people who are 65 and older that qualify, that's worked for at least 40 quarters or 10 years, or for those that are on disability under 65 that's had disability for 2 years. If you do have end-stage renal disease, you also can qualify for Medicare earlier as well too. Now, eligibility. So most people become eligible for Medicare when they turn 65. Again, like I mentioned to you, some individuals under 65 can qualify based off of their situation, but income is not a determining factor for Medicare. Again, that's going to be Medicaid as to what factors in terms of income for the coverage you get. And what does Medicare cover? So Medicare covers Part A. Again, I'm not going to confuse you with the alphabet here, but Medicare covers you for Part A, which is hospitalization coverage. So Part A covers hospital care in skilled nursing facilities and in some instances home health as well too. Now for home health, that's generally going to be free if you or your spouse have worked 10 years or 40 quarters. Part B, so Part B covers your doctor visits, the doctors that fill the hospital. They also cover outpatient care, preventative services, also durable medical equipment if need be. But just FYI, Part B does have a premium, and it can be taken out from Social Security, directly out of your bank account, or if you're on Medicaid, you can be on Medicaid and Medicare, funny enough, at the same time, then Medicaid will cover that. Part D, D for drugs. We'll keep it easy. D is for prescription drugs, so PDPs. They're generally going to have a premium. So how does funding work with Medicare? Obviously, you guys see on your taxes a Medicare tax, so you know that it's primarily funded through federal taxes. It's not managed at a level like Medicaid. So Medicare is not free unless you're on Medicaid at the same time. Again, if you're Medi or dual eligible, Medicare is not free. So most beneficiaries do pay a Part B premium, and there could be deductibles, there could be copays. So there could be deductibles and copays, but Medicare Advantage and prescription drug plans could also have their own respective premiums as well too. So these two programs are pretty distinct in characteristics, but you can, again, like I mentioned, have both at the same time. You can have dual eligibility. You can have Medicare, again, insurance for people who are over 65, and you can also have Medicaid at the same time, which you're called a dual eligible client or a beneficiary. At that point, there are special Medicare Advantage plans catered to you. So let me summarize the key differences of Medicare and Medicaid. So let's say the aspect is population. So for Medicaid, the crowd is going to be, of course, people who are low income. The Medicare crowd are going to be people who are over 65 and under 65 on disability or ESRD. So eligibility. So eligibility for Medicaid is going to be based off of income. Again, this is purely based off of income. And then for Medicare, it's going to be based off of your age and also your qualifications in terms of your health. So funding, Medicaid is funded by both the government and also the state. Let me go over the key differences between Medicare and Medicaid again. So one aspect is, let's say, population. So the Medicaid crowd are going to be low-income individuals of all ages. The Medicare crowd are going to be people aged 65 and older and certain younger disabled individuals. Now, another aspect, eligibility for Medicaid. It's based on income. It varies by states. And Medicare is based on age or disability. It's not income. Another aspect, funding. So Medicaid is jointly funded by the state and the federal. Medicare is just federally funded. The cost to the enrollee, Medicaid, usually low cost or free. Medicare, premiums for certain parts, like I explained, along with deductibles and copays. So depending on what your income is, depending on what your situation with your health is sometimes, usually low cost or free in those scenarios. But generally there is a Part B premium to pay to get original Medicare. And the last aspect is coverage. So with Medicaid, it's comprehensive. And of course, it varies by states. For Medicare, standardized coverage includes hospital, outpatient, and drug coverage. Right? So standardized coverage, hospitalization, outpatient, and drug coverage. So these two programs are going to be very distinct. But for some individuals that are both low income and seniors, you're going to be eligible for a dual eligible plan. So sometimes that could work out for you. What it does is it can give you more comprehensive coverage than you're offered with just original Medicare and just with Medicaid coverage. So hopefully this video did help. I just wanted to do a quick breakdown because I get this question pretty much every other day. So feel free to like and comment and subscribe to the channel so I can put out more content about Medicare, fun stuff, and also with the Affordable Care Act plans. I'll see you at the next video. Thanks for watching.